Hello, my lovely student. The topic of today is psychiatric pharmacotherapy. In this topic, you learn about two disorders. Firstly, schizophrenia, or in Thai we call จิตเภท and bipolar disorder โรคอารมณ์แปรปรวนสองขั้ว The objectives of the topics are describe general overview of schizophrenia and bipolar disorder, and then describe a treatment plan and indicate factors for rational drug use, and the last one, describe adverse drug reactions and management. Okay, let's start with this introduction. In this slide, I'd like to call your prior knowledge about pharmacology subjects. All of the medication on the screen, I think you learned it already, okay? But for now, we talk along with the disease, or in this case, we should call it disorder. Okay, let's start with the first one, schizophrenia. Schizophrenia, or in short, we call it schid. In schid, the drug that treats schid we call antipsychotic drugs. Or in the past, firstly, we call it neuroleptics because of its side effect, okay? The drug in the class can have side effect on neurology system, so we call it neuroleptics, but for now, usually we call it antipsychotic drugs, okay? Antipsychotic drugs is divided into two main groups. The first one we call first generation or typical, or second generation or atypical. In this table, I divide atypical into subtype because clozapine is the first one, is the first agent in the class, okay? First agent in second gen, okay? But the later second gen have some pharmacologic property differ from clozapine, so I try to let you know that it's not the same mechanism, okay? But in general textbook, they divided just two gen, first and second gen, so clozapine is included in second gen. What's in the first gen? It's composed of chlorpromazine, the prototype, thioridazine, fluphenazine, haloperidol, and so on. Almost 20 agents. And second gen, the first one, I told you that clozapine is the first one. And after clozapine, risperidone, olanzapine, quetiapine, ziprasidone, aripiprazole, and so on. Almost 20 agents also, okay? In the first group, I like to talk the ADR, or adverse drug reaction, in the big picture. Okay, let's see. For the first gen, the ADR that we concern too much is about EPS, extrapyramidal side effect. Extrapyramidal area is in the brain, okay? When the drug affect this area, it causes abnormal movement. In this case, we call the ADR EPS. So we try to develop the second gen to decrease this ADR. So second gen has lower EPS, okay? But the thing we got is a weight gain. Very first second gen cause too much weight gain, okay? Some patient have a weight gain for 20 kilograms. Oh, so that's a big picture, okay? And when we learn in the DUC class, we go to the ADR more closely. Next one, anxiety disorder. Anxiety disorder composed of benzodiazepines. Okay, in the past, benzodiazepine is the first line, but for now, because of many problems about the medication, like withdrawal symptom or drug addict, so benzodiazepine we use just a short course. Okay, like not more than 2 weeks. So now, antidepressants is the first line of anxiety disorder. Okay. Next, we move to depressive disorder. Depressive disorder, okay, the major disease is we call MDD, major depressive disorder, or โรคซึมเศร้า. The drug that treat depressive disorder we call antidepressants. Antidepressants, there are many groups of medication. Firstly, TCA or tricyclic antidepressant. The prototype is amitriptyline, okay, then nortriptyline. SSRI once is the most selling drug in the world, okay. Its name is Prozac or fluoxetine, okay. Fluoxetine, paroxetine, sertraline, and so on. Next group, SNRI, serotonin and norepinephrine reuptake inhibitor, okay. For example, venlafaxine and duloxetine. Tetracyclic antidepressant like mirtazapine and nore and dopamine, okay, like bupropion. Antidepressant, some of them are used in bipolar disorder. Okay, let's see. For the bipolar disorder or โรคอารมณ์แปรปรวนสองขั้ว you have to know that the nature of this disorder, like some periods of my sense is like 3 or 4 months or more, okay. In some period, the patient have depressed in we call depressive episode, and then they go back to be normal, and someday they go to be in mania or manic episode just for 2 or 3 months, okay, and the switch. We call the disease profile like this bipolar disorder, okay. First choice of bipolar disorder, we use lithium. Lithium is a very old medication that still work for this disease, okay. And for now, we have another choice, valproate, okay. For bipolar depression, we can use lithium, valproate, and quetiapine. Quetiapine is an antipsychotic drug. As you see, bipolar depression, we don't use antidepressant in the first line, okay. Antidepressant in bipolar disorder is the second line. Because in the practice, it cannot treat bipolar depression. Like it have a problem of efficacy, okay. It's second line, carbamazepine, lamotrigine, and so on, okay. We talk about it again. For this slide, I hope this slide help you recall the drug name from the subject pharmacology, okay. If you are ready, now we go to the content.